In the United States, some children's hospitals in COVID-19 hotspots are seeing more and more young patients in need of medical care. Children's hospitals across a number of U.S. states, including Florida, Mississippi, Louisiana, and Texas, are reporting an influx of young COVID patients. Now, this latest surge in infections is being driven by the highly contagious Delta variant and is most pronounced in areas with low vaccination rates. U.S. health authorities worry hospitals could get overwhelmed if the current surge of cases continues. And as we know, kids will be heading back to classes next month. So for more on this, I'm now joined by Dr. John McGuire. He is the chief of the Division of Pediatric Critical Care Medicine at Seattle's Children's Hospital, and he's joining us from Seattle. Thank you so much for your time this evening.
Thank you for having me.
So first, Dr. McGuire, I want you to just sort of describe for our viewers what it is that you're experiencing in your ICU.
We're experiencing a higher number of kids being admitted to the hospital and to the ICU with severe COVID infection. This is clearly a fifth wave of COVID in our region in Western Washington, and we had really no cases of children in the hospital at the beginning of July, and in the past several weeks we've definitely seen an uptick. And this is really concerning because this region is actually one of the higher percentage vaccination parts of the United States. And to see this increase now when we had hoped to be seeing minimal number of cases is worrisome. And particularly worrisome is the higher acuity of illness that we're seeing in previously healthy kids.
And I guess the obvious question here is, even though you have more vaccine uptake, so to speak, in the state that you're in, but kids who are under the age of 12, for example, they can't have the vaccine. So what impact is that having on the patients that you're seeing and the severity you're seeing in young children?
The cases that we're seeing come into the hospital are in children that are teens that are unvaccinated, or in younger children, primarily from families in which the adults aren't vaccinated. So the lack of vaccination in certain areas and certain pockets of the community seems to be a risk factor for these children. So it really supports getting all the adults and teenagers who can get vaccinated, both to protect themselves and also to protect the children that are around them.
Now, according to the American Academy of Pediatrics, children represent 15% of the weekly reported cases in the United States. So I guess part of the question here is, how did it take such a turn where it escalated to this point, given the fact that with the original strain of COVID, we didn't really see too many youth being impacted as such?
I think there's a few things. One is that a lot of adults are vaccinated, so the vaccine is highly protective against severe illness. Most of the hospitalizations in the United States are in unvaccinated people. And the vaccinated people who do have the so-called breakthrough cases are quite mildly affected. These children who are coming in are not vaccinated. And in terms of the percentage of cases that we're seeing, it's a larger percentage of the total cases, as I think might be expected when we have a larger percentage of the population that's not vaccinated being children. And what's concerning, though, is the Delta variant is the dominant one in our region right now in Western Washington and is highly contagious, seemingly more contagious than the other strains. And although we don't have enough information yet, there is concern that it may be causing more serious illness.
And I guess part of the major concern, as we mentioned off the top, is that school is right around the corner. All sorts of different regions, really, in both countries, in the United States and Canada, have said that students will not be wearing masks. California has mandated that teachers need to be vaccinated, but that's not existing across the board. So what are you expecting to see in the fall once all of these children, some of whom are not eligible for vaccines, go back to class?
I think it's worrisome when we bring a lot of kids together with risk of spread. There is a concern that there could be increased cases. We're strongly encouraging all eligible adults and teenagers to be vaccinated to minimize those people being a reservoir of infection that could then spread to kids. We're encouraging families and children to follow closely the public health official and Centers for Disease Control guidelines on masking where it's recommended. We are likely to see in Washington State, with the strong position that Governor Inslee has taken on masking in the past, recommendations for masking in schools here. We just had announced this week a proclamation from Governor Inslee for healthcare workers and state employees, including K through 12 school staff and teachers, to be vaccinated.
Now, finally, I did want to ask you about lessons that Canada can learn from the United States, because we know you mentioned off the top that you're in the middle of the 5th wave, and Canada here has essentially said that they're in the middle of the 4th wave right now. Children under 12 are also not able to be vaccinated. Schools are going to be in session for the most part. Children will be in classes. What lessons can Canada learn from what it is that you're seeing right now?
We're concerned that we missed an opportunity to avoid this 5th wave. With the availability of the vaccine and widespread distribution of the vaccine, that we had large areas, large parts of the country, in some places, majority of the population not seeking the vaccine. And our infection prevention and public health officials and our infectious disease people feel that we had an opportunity to avoid this, that with more widespread vaccination, we would have fewer severe cases, fewer hospitalizations, and consequently fewer vulnerable populations such as younger children being infected.
Well, we really appreciate your time today and you sharing that experience with us. Dr. John McGuire is the Chief of the Division of Pediatric Critical Care Medicine at Seattle Children's Hospital. Thank you.
Thank you very much.